Hello, my name is Andrea Boyack, and I'm going to talk to you about the economic impact of the COVID-19 shutdown of multiple parts of our economy and the legal responses to that. In this part A, I'm going to be focusing on the economic impact to individuals and households, families, and in part B, I'm going to focus more on the market as a whole and on businesses. Now, we are dealing, as we know, with not just a medical emergency, this global pandemic, but an economic crisis. In this country, there's been a near complete economic shutdown throughout the country, and really the governments felt that there was really two bad choices: letting the virus spread exponentially, not quote unquote flattening the curve, leading to potentially catastrophic loss of life, or to stop the virus from spreading, basically treating everyone as if they could be infected and having social distancing, and even more extremely, requiring people to shelter in place, quarantine. So as an attempt to try to reduce the deaths from COVID-19, we have had orders to shut down multiple businesses, almost all non-essential businesses. And that's true as of Tuesday, the 31st of March. We have 270 million people in at least 33 states, 89 counties, 29 cities, the District of Columbia, and Puerto Rico, all being urged to stay home if they do not work for essential businesses, which is defined as hospitals, certain government workers, food providers, and the like. And this has led to a massive economic slowdown, a recession, if you will. But it's unlike any recession that we've seen in the past century. Most of the recessions that we've seen in the boom and the bust of our economic cycle pertain to investment spending collapse, the dot-com bust, the foreclosure crisis. And the way the government dealt with these was to slash interest rates or buy assets. That's really not going to help a service sector recession. This recession is caused by depressed activity in the service sector. And interestingly, the service sector is traditionally seen as a source of economic stability, as opposed to the investment sector, which is more of a source of volatility. People go out to dinner and get their hair cut and go shopping and go see a ball game, even when the stock market crashes. But now they can't do any of those things. They are ordered to stay home. There are different people who are impacted by a service sector's recession as well. The people who are most impacted are the people who lose their income by being forced to stay home. And that often is hourly paid employees. They make up 2/3 of all retail, leisure, hospitality workforce, and most of them cannot do any of their job from home. They also are among the most economically fragile segment of our population to begin with, already facing difficulties staying housed, paying for food, and paying for medical costs. So what happened with the shutdown is we had a huge surge in unemployment filings. If you look at the 3.3 million people who filed for unemployment in March 2020 and compare it to the increase during the 2008 recession, for example, you will see that we have a massive number of people in our economy who no longer are getting an income. And so they are overrunning local offices and filing for unemployment en masse. Usually unemployment only replaces less than half of an income. However, with the CARES Act, that's the Coronavirus Aid, Relief, and Economic Securities Act, signed into law on March 27th, the federal government will provide an additional $600 a week or up to someone's full income replacement for 4 months if laid off during this crisis. That hasn't actually been rolled out yet, but when it does, it will provide a lot of relief for these people. And also, the CARES Act importantly covers for the first time people who are self-employed, freelancers, and workers in the gig economy. They were ineligible for state unemployment benefits before, but under the Pandemic Unemployment Assistance Program created by the CARES Act, they will be able to get a $600 payment. Some workers are not actually fired, but they can't come to work because they're sick or they have new caregiving requirements due to their children being out of school or a family member with COVID-19. This is a problem because most states and the federal government do not provide a mandate that employers pay for sick leave. And therefore, people who are living paycheck to paycheck and at this very financially fragile part of our economy, they really cannot, they have to choose between, do I earn money to live or do I go to work sick? That's a problem, of course, in times of a pandemic, and the federal government reacted by passing on March 18th the Family's First Coronavirus Response Act, the FFCRA, which provides federal funds enabling small businesses the ability to let people be off for up to 2 weeks of paid leave if they or a family member need care because of COVID-19. This was done in an effort to contain the crisis, but it really does highlight the question of whether or not there should be paid leave mandates in our society, because people, especially the lower income households, are already living at the edge of their financial capacity. Paycheck to paycheck, their budget is eaten up by 50% or more of housing costs, and they don't have enough to pay for things like food and healthcare. A loss or even decrease in income leads to a whole collection of other collateral harms. You have the problem of people becoming potentially unhoused, which is why you have foreclosure and rental moratoria being enacted by the CARES Act to push out the date that they will have to pay those housing costs. Of course, that's a problem because it's not necessarily true that they'll be able to pay it later. It's not like the income's deferred, it's just lost. However, it will at least keep people housed, which is a big part of the solution. To have a delay. Another problem of food insecurity, we have had a little bit of a supply chain disruption and hoarding, but the bigger problem is a lack of income of people to buy food. We have food programs that have been themselves disrupted by the shutdown, particularly the USDA school lunch program and school breakfast children that serves 35 million children every day. How do we get these children food? The law does not mandate the USDA food programs to continue when the schools are not operational, but many local school boards are taking matters into their own hands and trying to provide food for these children who are dependent on the school lunch and breakfast programs, basically for their food needs. We also have the food stamp program, the Supplemental Nutrition Assistance Program, or SNAP, that was recently targeted for reduction. There were going to be an elimination of benefits for more than 1 million households with children. That was being proposed right before the crisis. Now the CARES Act has included a $15.8 billion appropriation for SNAP, so there can be some emergency benefits provided to families who are already enrolled to cover the food costs. Healthcare access and costs is another question. Our health care in this country is very expensive, and health insurance is often tied to employment. Now, that means when people are laid off, they lose their health insurance, and that's in the middle of a pandemic. That's a problem because we're swelling the ranks of the already 27.5 million people in this country who have no health insurance at all. And even people with health insurance might, or are more often than not nowadays, have very high deductibles and making it even unaffordable with health insurance to seek medical care. This discourages people who need to seek medical care from seeking medical care, which can create more fatalities and adverse consequences from something like COVID-19. And it also could leave people with massive medical bills that they are unable to pay. And already, even before the pandemic, medical bills was the #1 trigger for personal bankruptcy. The CARES Act does provide that testing and potential vaccines for COVID-19 will be covered by the government at no cost to patients, and it does also mandate that private insurers cover COVID-19 treatment. Again, that's wonderful news and a wonderful step for people with insurance. It doesn't cover treatment for people who are not insured, however. Now, let me talk a minute more about the CARES Act, the Coronavirus Aid, Relief, and Economic Securities Act. It not only provides this unemployment payment expansion, which I mentioned, and a moratoria on foreclosures and evictions to keep people housed. It also provides some housing subsidies to help support affordable housing that's administered through public housing authorities at local levels, and sets up emergency money for localities to further support housing needs at providing maybe deposit assistance or emergency shelters. But it also, interestingly, provides for stimulus payment. That's $1,200 per person, plus $500 per dependent child. And there's no income floor. It doesn't matter if you paid any taxes, although you have to have filed your tax return in 2018 or 19, but it doesn't matter what your income was or if it was zero in those years. You still are entitled under the Act to this one-time $1,200 per person payment up until your income is $75,000 per year with an allowance for children. And then there's a scaling down of the amount you'll get until there's no stimulus payment to anyone who makes more than $99,000 a year. That's a wonderful payment. It probably is not enough, particularly in places on the coast where the cost of living, when you include housing, is significantly higher. It also might take several months to actually roll out. The 2008 stimulus plan took 6 months to pay, which means that although people might eventually get some money to offset their additional costs and decreased income due to the shutdown, it might not come quickly enough to be of any immediate help. There are also some problems related to loss of income that have to do with debts. Predictably, when people don't have money coming in, they might not be able to meet their payment obligations. I mentioned mortgages already, and CARES institutes, as I mentioned, a moratorium. It's actually a 60-day moratorium on foreclosures, but that's only for mortgages that are backed by federal entities. USDA, FHA, VA, HUD, Fannie and Freddie. And the moratorium actually could be extended to 6 months if the borrower requests and cites a hardship. Many borrowers do not have government-backed mortgages, and in those cases, really relief options are dependent upon what the servicer decides to do, unless there's an applicable state law, and some states have been passing some moratoria in the breach. With respect to student debt, the CARES Act mandates that the Secretary of Education suspend all payments that are due for federally held student loans until September 30th. That's an automatic suspension of payments. There's no interest accruing on the loans during that time, though all those months count towards as if they had been paid for public service loan forgiveness program. There's no collection efforts. There can be no credit reporting adverse effects. So that happens automatically. You don't have to pay a fee. There's some weird scam going on around that based on the CARES Act, and the Department of Education will notify each borrower that the payment has been suspended and advise the borrower with respect to how and when the payment will recommence. There are, of course, many other consumer debts, as I mentioned, medical costs, and some of these will lead to consumer bankruptcy. Prediction now is that there will be many more bankruptcy filings in the next year or two as a result of the shutdown that's going on right now. There have been, in the CARES Act and just before, some changes to the bankruptcy law. Because of COVID-19, people who are in a reorganization plan can modify it. That plan, which could be 3 to 5 years, can now be stretched out to 7. And there are some logistical problems with bankruptcy proceedings due to the shutdown that are currently being ironed out, like the question of whether there needs to be in-person Section 341 meetings of the debtor himself with the trustee that gives the creditors the opportunity to show up and be heard, or whether that can be done through some sort of a web conferencing or something like that. And so that is what we're dealing with right now, and the CARES Act has been one of the very big first pushes to go back, and more in Part B with respect to the market as a whole and businesses.